My name is Li Bai. I am an epidemiologist at the Institute for Clinical Evaluative Sciences in Toronto, Canada. On behalf of the research team, I'm happy today to talk to you about the abstract. Previous studies have found that long-term exposure to air pollutants such as nitrogen dioxide may increase the incidence of hypertension and diabetes. However, little is known about the impacts of ultrafine particles. Ultrafine particles are the smallest particles in the air and mainly come from diesel vehicles in the urban areas. Our study population include all Canadian-born residents aged 30 to 100 years who lived in the city of Toronto from 1996 to 2012. Our final cohorts included almost 1 million people. We used a validated algorithm to link province-wide chronic disease database to determine our study outcomes. We estimated annual concentrations of ultrafine particles and nitrogen dioxide using land use regression models based on monitoring data, and then we assigned these estimates to individuals' annual postal codes during the follow-up. To evaluate the associations, we used random effects Cox proportional Hathis models with adjustment for both individual and neighborhood level risk factors. We found each interquartile increase in ultrafine particles was associated with a 3% increased risk for hypertension incidence and a 6% increased risk for diabetes incidence, even after adjusting for fine particles and nitrogen dioxide. We also observed that exposure to nitrogen dioxide may increase the risk of diabetes incidence. A main strength of this study is our ability to categorize the associations between long-term exposure to ultrafine particles and the development of hypertension and diabetes over 17 years of follow-up. However, similar to other large cohort studies, we were unable to direct adjust some individual level risk factors. To our knowledge, this is the first population-based cohort study to investigate the association between long-term exposure to ultrafine particles and the development of hypertension and diabetes, and we did find a positive associations.